Welcome back, everyone. My name's Daniel, pediatrician. This is one of my favorite things to talk about and explain to families when they come and see me to manage their child's ADHD. And what we're going to be talking about is around all the different options that are available for us to help a child with ADHD. So I'm going to break down and give an overview of all of these different treatment options and management options that we have. Okay, so first of all, we need to focus on the child's strengths. Are they creative? Are they spontaneous, high energy, social, very curious, or hyper-focused on things that they're really passionate and enjoy? Because it's important that through this journey of this child's life with ADHD is that we focus on their strengths as well as try and help them with their weaknesses or difficulties. Because focusing on their strength, allowing them to shine in those areas where we can see their brilliance, it's good for us, and it's most importantly, it's good for the child. It's good for their self-confidence, their sense of worth. So I just want to really sit with that for a moment. The other ways that we help a child with ADHD can really be broken down into two groups. They can be broken down into medication and non-medication support options. For most children with ADHD, we like them to be on a combination of both those things. So let's talk about non-medication treatment options to start off with. The biggest thing around non-medication treatment options is usually around strategies. What are those behavioural modifications? What are those environmental modifications that we can make? Those tips or tricks that we can give the teacher, the parent, to help them address the underlying difficulties of their ADHD to reduce the impact of those ADHD symptoms on the child's everyday life. The other part is around parent or family training. This can be a little bit harder to access. It's easy just to find a bunch of strategies that might be useful, and I'm going to run through a bit of them in this course to give you an overview of the best ways that I've found of helping children. But the other way is around parent and family training. And what do I mean by that? Basically, it's similar to what you're doing now. It's helping understand the ADHD, coming up with a number of strategies, knowing what options are out there in terms of managing their behavior so that we can help a child, help reduce the impact of those ADHD symptoms on their everyday life. Another part of the non-medication treatment is to identify and manage any associated difficulties that a child with ADHD might have. Is it anxiety? Is it a behavior problem? Is it a specific learning disorder like dyslexia? Because if we can manage those problems, then again, we can improve their quality of life, improve their functioning and their relationships without the need potentially for medication in some situations. Now let's talk about medication treatment options. Generally, when we talk about medication treatment options, there are two groups of medications that we commonly use: short-acting stimulants and long-acting stimulants. I'm not going to talk about the other options, though there are a couple more. But the reason I talk about these two is because 90% of children with ADHD get benefit from them. Our short-acting treatments are usually around, in Australia, dexamphetamine and methylphenidate or Ritalin. And the long-acting is generally around Ritalin long-acting or Concerta, or Vyvanse or lisdexamfetamine. And each of the different medications has its own strengths and weaknesses, and it's important to understand those before starting medication. And that's what a pediatrician or psychiatrist can help you with.